Hello, my name is Valentina Vasco and I am going to talk you about the survival time of restorations is shortened in patients with dry mouth. Dry mouth is a common health problem that affects 22% of adults and can include both xerostomia and hyposalivation. Caries and xerostomia are common among patients with hyposalivation, although xerostomia and hyposalivation can also occur independently. The most obvious cause of dry mouth are Sjogren's syndrome and radiation therapy to the neck or head region. But a more common cause is medications, especially polypharmacy and sedatives. Restoration for patients with dry mouth have a high failure rate. To provide personalized dental care to patients with dry mouth, it is necessary to determine a survival of different restorative materials in patients with a dry mouth. The purpose of the study carried out was to identify the reasons for the short duration in the mouth of the restoration, taking into account that the patient studied had xerostomia linked to different factors. Method. The study was carried out thanks to the collection of data in patients trained in public dental service in Finlandia, with a Kaplan-Meier curve and Cox regression analysis. The study was carried out on 71 patients who don't have control in the disease and in 142 patients with controlled disease. In total, a study of 3,208 restorations subjected to different characteristics was carried out. But what is the Kaplan-Meier curve and the Cox regression? The Kaplan-Meier curve is a statistical method used to estimate the probability of survival of a group of subjects over time. It was used in the study the survival time of restoration in shortened in patients with dry mouth to analyze the survival of dental restoration in patients with dry mouth. The Cox regression is a statistical method used to analyze the relationship between a set of predictive variables and a survived outcome. Commonly used in medical research to find risk factor for disease or treatment failure. It allows researchers to estimate the risk index, which is the ratio of risk rates between two groups, while controlling for other variables that may affect the results. The hazard rate is the probability that an event will occur at a given time, such as death or recurrence of a disease. It takes into account time to the event, censoring and other factors that may affect the outcome. Results of studies with Kaplan-Meier curve. Kaplan-Meier curves demonstrate that the survival of restorations and teeth was reduced in patients with dry mouth compared to control patients. The risk index of restoration in patients with dry mouth was 2.08 compared to control patients. Fixed prosthetic crowns last longer than composite fillings of all sizes in patients with dry mouth, but the difference increased concomitantly with filling size. Patients with dry mouth had a hazard ratio of 1.98 for dental extraction compared to control patients. The study found that restoration material and size show high risk rates, while risk rates based on tooth type and patient sex were lower. The study concludes that when informing a patient with dry mouth about the expected survival of a restoration or tooth, it should be taken into account that restoration and teeth of patients with dry mouth have severely shortened survival time. Result of studies with the Cox regression. The analysis was adjusted for tooth type, restoration size, restorative material, patient sex, and age. The first multivariate Cox regression analysis revealed that the hazard ratio of restoration in patients with dry mouth was 2.08 compared to control patients. The second analysis revealed that the risk ratio for restoration was higher in patients with Sjogren's syndrome, or a history of radiation therapy to the head or neck region. Third analysis was performed that determined the effect of omitting patient characteristics, sex, and age on the risk index associated with dry mouth, restorative material, number or surface, and tooth type. Fourth analysis revealed that the risk ratio for composite restoration covering 1, 2, 3, 4, or 5 surfaces were higher compared to fixed prosthetic crowns. The study results highlight the need for clinicians to take into account the impact of dry mouth on tooth restoration and survival when informing patients about expected outcomes. Conclusions according to the research results. The survival time of restoration and teeth is too short in patients with dry mouth. The survival time of large composites is shorter than normal in patients with dry mouth. It was also concluded that despite dry mouth, patients with fixed prosthetic crowns don't have such bad results since they have an acceptable duration. It is very important to inform patients with dry mouth that the expected survival time of their restoration will be shorter. What happens at the cellular, genomics, and proteomic level in relation to the investigative study? At the cellular level, when the patient has a dry mouth, the epithelial cells and taste receptors will be dehydrated. Insufficient saliva development makes it difficult to form and lubricate the bolus for swallowing, improve taste, initiate digestion, prevent erosion of the mucous membranes, lubricate improve the ability to speak, maintain bacterial balance, and the effect of dental demineralization. Histopathologically seen in a dry mouth, lymphoid infiltration, acinar atrophy, and hypertrophy of the ductal epithelium, with gradual obstruction of the lumen and development of islands of myoepithelial cells formed from the proliferation ductal epithelium. What happens at the genomic level? Dry mouth can be caused by certain conditions that have been studied throughout the human genome, such as diabetes, Alzheimer's disease, as well as autoimmune disease such as Sjogren's syndrome or HIV and AIDS. Genetically, this disease alter or modify the cells so that dry mouth occurs. What happens at the proteomic level? Researchers have identified 309 proteins in total saliva. More than 95% correspond to the main protein families that include proline-rich proteins, salivary alpha amylase, mucins, agglutinins, cystatins, histatins, and statherins. Together with the progressive advancing knowledge of the human salivary proteome, that possibility of using saliva as a useful tool in both the diagnostic and prognostic. Various studies have been carried out applying various techniques using both stimulate saliva and unstimulate saliva. Most of these preliminary studies in which various methods are used have focused on research of diagnostic biomarkers in order to validate or classify a salivary proteomic panel. The data obtained from these studies indicate that secretory proteins of acinar origin are reduced, while inflammatory proteins are increased when compared to the healthy control subjects. The increase in inflammatory proteins tends to correlate with chronic inflammation and persistent damage to the salivary glands in the oral microenvironment. The decrease in secretory proteins is attributed to the damage and dysfunction of acinar cells and the presence of fragmentation process, which may be related to an expression imbalance between proteases and protease inhibitors. These are the references used. Thank you.